You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. He says no more dentures. With us, we have an expert on this topic of dental implants, Dr. Tony Cigno. Dr. Cigno, welcome to the program.
Thank you very much for having me. It's an honor to be here.
So before we get into today's topic, for people that don't know you, your practice, like who's the typical patient and what are the different services you offer?
Well, every day is different. We don't really have a typical day. We start by seeing patients when they're 3 years old. We do standard cleanings, general cleanings. We do non-surgical gum therapy. We even have the ability to do CEREC one-visit crowns, where somebody wants to come in for a crown that I have total control of, and they can get their crown in an hour.
Is that right?
That's absolutely
right. So teeth
right.
in like this in the same day?
Teeth in a day without a problem. It's standard what we do. It gives me more control. Some people, they can get their teeth, their crown the next day if they choose, if they need to be done quicker. But most people have a crown in a day, and we don't have to go through the goopy impressions and send it out to a lab where there's some guesswork involved. I can be very, very precise with the CEREC technology, and if I don't like the way it is perfectly, I press a button and 5 minutes later we have another crown that's just exactly the way I want it. So it's amazing. We also do a lot of braces. We do adults and children, and we use fast brace technology.
What does that mean, fast brace?
Well, fast brace is a totally different technology that is designed that it moves the crown of the tooth, the part the patient can see, above your gum line, and the root of the tooth at the same time. And it uses it with one single wire. And the beauty of it is it moves the entire tooth at the same time, so you have greater stability, greater speed, and it's less cost to you because we pass that time and savings on to you.
So traditional braces are about 2 years?
Traditional braces are about 2 to 2.5 years.
This could be like 6 months or something?
This is anywhere between 3 months and 12 months.
Nice.
Yeah, it's fabulous, fabulous technology.
So you're big on technology. You have your own cone beam there, intraoral cameras.
Correct.
What does that mean to the patient, having all this stuff?
We believe in great technology. We want the most advanced technology so that's working behind the scenes so that we can take care of you as a person.
Okay.
And we have cone beam, which is a 3D imaging system like a CT scan. We have intraoral cameras. The 3D imaging allows us to see what we can't see in 2 dimensions and be more precise. The intraoral cameras allows you to see what we're seeing. And I believe the more that you know about what's going on, the better decisions that you can make for yourself. And we have lasers, we have digital technology. Everything is designed so that the patient has a great experience, and we're very precise.
Because people don't like going to the dentist,
People
right?
can't
Do you
stand
ever
them.
hear that?
I hear it every day.
You do?
I hear it every
what
day.
do you say to that?
I say, I don't take it personally, but I understand that you don't like sitting in this chair. And my goal is to get you out of this chair as efficiently, quickly, and comfortably as humanly possible. And the better you communicate with me, the better I can make your experience here.
Okay, good. Now, today we're talking because you believe that nobody should be wearing dentures.
Absolutely.
That ideally, they've got like implants that they're attached to.
Right.
Is that right?
Absolutely.
And so before we get into that, because I know you brought that, but you've always wanted to be a dentist. 4 years old, you told me on the telephone.
Right.
That's
right.
hard to believe. How do you know that?
Well, I believe I was 6, but my aunt told me about 2 years ago, you're about 4. And I remember sitting watching a movie. It was a father-son type movie. My dad's a dentist, and he's still a dentist practicing in St. Louis. And I just remember thinking, I want to be just like him. And out of 5 kids, I was the only one that ever was interested in going up with emergencies with him on the weekends and stuff like that. I was always the one that went. And I just am just so grateful because I have a passion for it. I love doing it, and it's a great way to touch people's lives.
Okay, good. So you say no more dentures. You believe that?
Absolutely believe it, 100%.
So the future of dentistry, everything is going to be attached to an implant? Is that what you're thinking?
I think the future is now, believe it or not. I think that the technology that we have in implants, and the implant dentistry has grown so much that we can do so much more with so little. We don't even need, we used to believe we needed a ton of bone. We don't even need a ton of bone anymore to get stable implants. So people don't have to walk around with floppy dentures. They don't have to walk around smiling behind their hand. They can laugh. They can go out in social settings and be close and intimate with people now that they don't understand that they can do. Okay, dentures are not necessary like they were 10 years ago.
Okay. Now, in your practice,
yes,
you can do things very quickly.
Absolutely.
I guess on the day of the procedure, they can walk in without teeth and walk out with teeth.
Absolutely.
Is that right?
That is 100% right. It takes a little bit of planning, but we're able to place the implants and place the restorative work at the same time, at the same day. So they walk in without teeth, they walk out with a full set of teeth, and they can smile and chew, and they're very, very comfortable.
You say it transforms people's lives.
Oh.
How so?
Well, you know, it's the most amazing, most gratifying part of what I do is listening to the stories on how people's lives have been transformed. I just had a gentleman last week came in, and he's 92 years old, and he said, you know, this is the best thing I've ever done for myself. And I said, well, why is that, Hoyle? And he said, because you know what? I can chew and eat anything. These are like my own teeth. And, you know, I said, I just asked him, said, Hoyle, how old is your wife? He smiled and said, she's 24 years younger than I am. You know?
Okay.
So it was a great refreshing
So this was
thing.
the guy that was wearing a denture before he met you?
His teeth were in bad shape. He didn't have a full denture, and his teeth were in really bad shape. They were loose. His gums were in bad shape. They were bleeding. He was uncomfortable, and it just wasn't a good situation. They were not worth investing money in to save them. We could give him something better, something more stable. And he didn't want a flop around denture. He's a very vibrant person, and he wanted to stay that way, and he wanted to feel like a man. So we did 4 implants and locked his teeth in place. They don't come out. I take them out once a year to clean them. And this guy came in last week and said, it's the best thing I've ever done for myself.
Really?
He said, I can eat an apple, I can eat a steak, I can do anything I want. He said, I can laugh, I don't have to worry. You know, I was so worried when my teeth were bad before that if I had to go to dentures, that I'd be doing this, or that I'd be laughing and they'd fall down. You hear stories about putting dentures in jars. I don't want to live my life that way. He said, this was the best thing I've ever done.
Now, okay, so 4 implants, like on the lower.
Correct.
You can give them a full arch of teeth that snap in, they're locked in, they don't come in and out.
Right, absolutely.
Right? It seems painful. I mean, it's got to be painful, especially for a 92-year-old.
You know, it really isn't. I just had a patient last week, Monday, that she's actually 96, and we did.
Really?
We placed an implant. The whole procedure took about 8 minutes, and we placed an implant. And we usually offer pain medication of 2 Advil and 2 extra strength Tylenol in the chair as they're there. And she said, no, I'll just take 1 Advil. I called her the next day. She had no pain at all. Didn't take even a second Advil. None at all.
Why would a 96-year-old want to do this?
Because a 96-year-old wants to live life. She wants to enjoy her food. You know, so much of what we experience in life is centered around gathering around food. If you think about it, we socialize around that. And when people are older like that, or it really does, age really doesn't even matter, but when people are older, they have more people come in to see them, and they bring things with them, and the gifts are quite often cookies and candies, and you know, or they go out to dinner or go out to lunch quite often. So a lot of social things happen around food, and these people want to live their life, and they want to get the zest and the passion and everything that they always have had their whole life. So they don't see their age, a number as age. They see vibrance and all types of great possibilities.
So it doesn't matter the age?
Age doesn't matter at all.
Now, are there a lot of people where you are that have dentures?
I live in
Big group?
Yes, absolutely. I live in Milwaukee, and we could probably fill Brewer Stadium with the number of people
Is that
way.
right?
Yeah,
There's
so
that
you're
many people
talking,
with an
you
upper
know,
lower denture?
Absolutely.
Well, if it's so good to, you know, fix them, do implants, why aren't they all doing it?
Well, there's
What's
a lot.
your take?
There's a couple reasons. If people that already have dentures right now, if they've had them for 10, 20 years, a lot of them don't know what's possible. Okay, their first experience, their experience that got them to dentures with dentistry was not good. Their teeth were bad. Nobody loses teeth because of a good experience. So they either had a bad experience with the dental office, and so they were fearful, and they didn't take care of themselves, and they never went regularly, or they had gum disease and things became painful or decay, and by the time they got their teeth taken out, they were just fed up. And they said, I'm done with this. I just take them out, and they think that's the easy way out. Well, as we know, the easy way is rarely the easy way out.
So they don't know their options?
They don't know their
options?
options.
They don't go to the dentist?
They don't go to the dentist. Once they have the dentures, they don't feel they have to go to the dentist anymore. And so people with dentures really don't know the opportunities they have.
Okay.
And, but now, if I can just get them in, if I could get, say, 20, 30 people a Friday to come in, and I give them, I say, okay, I will give you a full set of teeth that you can eat with and chew with that snap in or lock in.
Like a test drive. You're talking about like a test drive with dental implants.
Absolutely. If they did a test drive and they did it on Friday afternoon, And I said, I'm going to give you till next Friday to test these out, or even till Monday. And I said, okay, but on Monday, I'm taking them back. All right? I would guarantee you, not one of them would come up and show up that day on Monday and let me take them back, because they have a whole new life. I mean, these people that come in after we've worked with them and given their teeth back, okay, they feel whole again. They come in and they're standing up straight. They're excited, they're smiling, they're laughing, they're interacting with my team and so forth. They're like new people. It's like they take 20 years off of their life on the good side.
And you say, so pain is not something that they should worry about?
Pain is not something they should worry about, because there's quite often, with the easy implant system, we don't even make incisions.
You call them easy implants, is that right?
Absolutely.
Why is that?
Because it's efficient. We design all our systems to make it quick as possible on the patient, because the patient doesn't like to be in the chair. But we design the systems to make it quick and comfortable. I got to keep them safe, all right, and I got to keep them comfortable. And it's easy because there's no incisions. We don't have to open up the gum tissue like we did 10 years ago to get a three-dimensional picture of where that bone was, because we have the three-dimensional technology where we take a scan and plant it all in the computer. So all the processes, all the work happens before the patient's in the chair. So everything that the patient is designed for is easy.
Now, are they lightly sedated during this?
Some can be, but most.
So they don't feel anything during the procedure?
They feel pressure. They feel pressure like you have it on a handshake. That's it. Or if I put my hand up against their face.
But isn't it true, one of the problems is with dental implants that if you've been wearing a denture, false teeth, for 20, 30 years, you don't have enough bone, that you can't do this?
That's actually a myth, at least in our office. In some offices that might be the case because they don't have the technology. They only go through two-dimensional x-rays. But with the three-dimensional technology, we can actually see that we have a lot more to work with than we believe before.
So if you're 30 years in a denture, the chances are you can still work with them?
Absolutely, 100%. My mother-in-law, for instance,
okay.
Had her teeth taken out. She had her teeth taken out when she was 28 years old. And she is now 80. And we placed dental implants on her about 5 years ago, maybe 7. And she said that's the only reason that she loved the fact that I married her daughter, actually. So I think that is at least Audrey. So,
but denture wearers, I know a couple, right? They never complain about their denture. Are you saying that that all denture wearers aren't happy?
Well, I believe that they're not happy because, they're not going to complain to you. They're embarrassed. They don't want you to know that they don't have their natural teeth. So they complain to me, all right? Or they complain to themselves. They look in the mirror and they don't feel whole. They have to, that's not what they want to do. They want to smile and feel whole again. And so no, they're not happy. They hold themselves back from the rest of the world.
So this is a game changer in dentistry, in a way.
Absolutely.
This is like the hot thing.
This is the hot thing.
You've been doing it a long time. I mean, you've been in and around implants for how many years now?
I've been working with implants in one way or the other for about 25 years now.
You're also a guy that goes to a lot of continuing education,
yes,
you
I
say.
Do. Yes, I do.
In fact, you're here in San Diego for a continuing education.
I am.
Is there really that much to this?
There's a lot to the technology of dentistry. There's a lot of things that are growing and changing. Dentistry's grown immensely, what we can do in the last 10 years, certainly the last 5 years even. You learn about not only techniques, but you learn how to care about people, okay? So there's a lot to learn. You keep on growing, you keep on the cutting edge. As you said earlier, my father's a dentist, and he instilled that in me since I was a young boy, that you always stay on the cutting edge. You always continue education. You stay fresh, you stay alive, and you be one of the front runners. And that's just in my blood. And I believe I always have to get better. I want to be better next year than I am right now in every aspect of my life.
Now, in your office, though, you've made dentures for hundreds of patients over the years. They may tune into this show. What do you want them to know about what you're doing now?
I want them to know that in a very easy procedure, they can have their dentures locked in place, their teeth locked in place, that they don't have to take them out anymore, and that they can eat and chew anything they want, that they have the possibility to have that again. They can be young just like they had their original teeth.
Okay.
That's what I want them to know.
What about the crowd of people that their teeth have to come out? That means they have to go. They know they don't want false teeth, right?
Right.
Isn't it true that if you have gum disease or bad gums, how are the implants going to go in there and stay? Well, that's my question.
Gum disease only goes if there's teeth. The bacteria that causes gum disease is on the teeth. So if you remove the teeth, the gum disease goes away. So the bone can
And the gum gets healthier?
The gum gets healthier, and the bone and the foundations can be very solid and healthy, and we have no problems placing implants, where before, 10, 20 years ago, we thought we would have problems in that situation. We don't have those problems.
Now, you brought some animation. What are we looking at right here?
Well, Randy, what we're looking at is the placement of the implants and the snapping on of the teeth that go on top of the implants. Okay, and this becomes solid. They don't take these in and out. Hear me here.
So if everybody, like you said, you could fill up what, Brewer Stadium?
Yes.
You said with people
Yeah.
where.
Yeah.
So if they knew about it, you couldn't even service all of them. That means not you, but a dentist couldn't.
We would be so darn busy. We would be working 7 days a week. I mean, to make people happy and be able to chew again.
Okay, so you brought some models.
Yes.
Now, if somebody were to come in, whether they're no teeth or they're wearing a denture, do you show this to them?
These are the models we use.
So that's an actual model, that works. Let me see you pull that off.
Correct. This is an actual model that works, that we show people what their future can be like. And you can see, it's not really easy to get off.
Okay.
Okay. And people have this problem in my office. I have a little lady, her
Let me
name
see
is
this
Madeline.
before you snap it back on.
Her name is Madeline, and we gave her they gave her just like that 6 months ago, and she's been in my office at least 7 times for me to get them off, because and we don't want people to have that problem, okay? But that's how snug and tight these can be.
Okay, so this is like the lower jaw.
That's the lower jaw.
Right
We
here,
place
there's
two little snaps.
Two little snaps.
And it just lines
Right
up
here.
and snaps in just like that.
Okay, and then
And you can hear it like that in
But
their
this
mouth.
seems like it's too tight to pull it off.
Well, we have a variety of different type of gaskets that have a different tightness to them. Okay, so we customize that to the patient.
So it's 2 implants and no more
Implants.
adhesive.
No more adhesive, no more nasty tasting, sticky, goopy adhesive at all. They can eat and chew just fine. This is actually exactly what I did for my mother-in-law. We gave her 2 implants on the lower, and she has a snap-on denture now that, as you can see, is very hard to get out. Now, we did this about 7 or 8 years ago. Now, if I was going to do it, we're actually planning to do this. In the process of planning, we're going to place 2 more in back. And now what we're going to do now is we're going to give her a fixed set of teeth on top and bottom that she can't take out, so that she has to come up and visit me from St. Louis and at least once a year, so I can actually take them out and clean them for her.
So that's probably what everybody wants.
That's what, absolutely. Everybody wants to feel like they have all their natural teeth again. Nobody wants to take off a body part.
So you brought another model. What is that?
Yeah, I brought another model. Now, this is very exciting, because when we use this, we give people a fixed set of teeth. So what we have, you notice that there's no acrylic on the inside part of the model, okay? So this is for demonstration purposes, but what we do is give them the 4 implants, and we lock this in place, and I take this out once a year and clean it for them, okay? But it gives them a full fixed set
Now,
of
what
teeth.
can they eat with that?
They can eat everything with this.
Like what?
There's nothing. They can eat. I don't recommend it. They can chew up to their pork chop bone if they want to do that. I still don't recommend that.
I mean, could you eat like a carrot?
They can eat carrots. They can eat raw broccoli. They can eat cauliflower.
So it doesn't matter. I mean, you could pretty much eat
Apples,
anything you
steak,
want.
everything that they want. This is as good as close as what God gave you as we can get. Okay. Now the beauty of this on the upper, when we do this on the upper, you notice there's no plastic here, none at all. Okay. So the patients can chase their food for the first time in years, because the plastic of the denture covers up taste buds. So you get people that come in and after they've had their dentures and they have a stinking tear in their eye because they said, I just used to love to eat and I've not tasted these flavors for decades. And that is where the juice of what we do is. That's where it's fantastic.
I know you do, or you told me you do a lot of cosmetic dentistry, a lot of these full mouth, rehabilitation of the mouth. But for denture wearers that get their teeth, is this the happiest group of patients?
Oh, absolutely, because they know how bad it was. Okay, they came from quote unquote the dark side, and now they're seeing the light again. And it's just great because they come in, they bring you gifts, they hug you.
Really,
it is the most exciting, fun part of my day is when I get to see people coming back in from this, because you're changing their lives. So Randy, what was your dad's like? Your dad had dentures with an implant.
He did, and he was wearing dentures about 35 years.
Okay.
I forced him to watch one of my interviews, right? And he goes, I'll talk to the guy. And now he has teeth on the bottom, right? And he can play the trumpet and do it. Yeah, he doesn't have to think about his teeth anymore.
Yeah, because he can play the
Well,
trumpet.
for him, he feels better.
Yeah, he can probably hit those high notes that he couldn't hit with a denture.
Probably,
because it doesn't move back.
And he said it didn't hurt at all. He said, Randy, I was so worried. He never told me this.
Yeah.
But the next day he said, this is a fact, He said, I think you need to tell them to let us really know that it doesn't hurt
Yeah.
at all. But I guess legally, I mean, you can't say that to a patient because everybody's different.
Everybody has different pain
But
tolerances.
pain is not a problem that they complain about?
Pain is never an issue.
Because it does seem painful.
I'll tell you what, if I place 100 implants on 100 different patients, I might get 3 that would say, you know what, I had to take Advil for a couple days. And that's about it. Because for the most part, there's no feeling in the bone. And we're not making we're not making any incisions in the gum tissue with the easy implant systems because it's guided based on the computer-generated technology from the 3D imaging that we have. And so we're not making any incisions trying to figure out, do we have enough width of bone? Okay, all the pain comes from the incisions and so forth. We're not doing that anymore. So it's really virtually a pain-free experience.
So no more dentures?
No more dentures, no pain, no.
And your mother-in-law is going to go from a snap-in, snap-out to a fixed set of teeth?
Absolutely. Absolutely.
Okay.
And we're very excited
What
for
do you
that.
tell her? I mean, do you try to get her excited about it and say, hey, you got to do this?
Oh, I don't have to try to get her excited about it. She's like banging on my door, So no, I just got to figure out the proper time to do it for her because she's got to traveling and stuff like that from 2 states away. So
now, insurance doesn't cover the entire process, right?
No,
or
insurance-
Medicare doesn't cover it.
That's right. Insurance doesn't cover the entire process. But you know what? We have plans that make it affordable. We work with different finance companies and so forth that people can make payments over time and still enjoy the full set of teeth.
Okay.
And so they don't have to worry about, well, I can't afford it, because it's not the case anymore. But remember, Randy, with just 2 implants, we can get people on the way to a better life in a snap-in and snap-out type prosthesis that feels like their natural teeth and that they can chew with again.
And they can work up
And they can always work up and add more, and we can retrofit those implants to their existing, so they don't have to throw away the old and come with the new. We can work with what they have. So they can build up and do this in phases in a very short period of time. If they can go from the snap-on to the full set in a virtually small part.
Now, what about making them look real? Because I feel like I could spot a denture walking down the street.
Well, you can spot a denture walking down the street, but you can't spot these walking down the street. That's what's amazing. People can eat and chew and smile just like they're their natural teeth. And I have a lady who just came in last week, and she said, you know what? I came here because I wanted to chew. Now I want to smile. That is just amazing. So
Good.
It's great.
So, final message. I mean, we're out of time. If a patient comes in and they are wearing a denture, what other options from the minimal to the best thing you could do for them?
There are options from the minimal. It would be 2 implants on the lower, 4 implants on top, and we can get a snap-on type prosthesis or snap-on smile, basically.
Okay. And that's a full arch of teeth?
That's a full arch of teeth, and they'll be able to chew most everything really, really well. Or we can do 4 implants on bottom, 5 implants on top, and lock that in place, and they can eat everything they want. Apples, carrots, broccoli, everything. They have no limitations, none at all.
Okay. Now, just to clarify here, the way it's normally done across the country with dental implants, you go to one dentist that does the surgery. Then you go somewhere else where they put the teeth on top, right? And maybe even somewhere else for the imaging. You do it all right there.
I do.
Aside from convenience, is it better? I mean, do you think the way you're doing it is the best way to go?
It makes sense to have it all done in one spot because I have control over every aspect of it. I have a control over where the implant is placed because of the 3D imaging, and the implant is placed with the final result in mind. And what I mean by that, when I say the end in mind, I can control where the teeth are going to be placed. I can control how they fit with their face, the color, the natural smile line of the teeth, and they don't have to go to other surgeons and so forth. And it's going to cost them a lot less by doing so.
By having it done, just
Having
one guy
done,
doing it.
we pass that savings on to them.
Okay, good.
It's much, again, it's easy implant systems because I have total control.
Okay. Now, the people, are they traveling to see you?
I have people coming up from Florida to see me.
Is that right?
Absolutely. St. Louis, Florida, Chicago, all over. And it's just a great honor to do it for them.
Now, we are out of time completely. But final message to the person, maybe they're wearing a denture, or they know that their teeth have to go, but they're still skeptical, right? It seems painful, et cetera.
Right.
What do you say to them?
So what I say to them is, come in and meet us. I invite them in for a free consultation. Won't cost them a thing. We'll give them as much time as they need, answer their questions, find out what's important to them, all right? And see if they're a candidate. See if they're a fit. See if they want to move forward and be whole again.
And it transforms lives.
Yeah, transforming life.
I say that with a smile,
Yeah.
but you believe that.
I absolutely believe we see it every day. We transform people's lives every single day.
I want to thank you for coming in. Great stuff.
Thank you.
Great
Randy.
info.
It's a pleasure to be here.
You've been watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.